If you were told that the largest percentage of your body was under constant threat of getting cancer, wouldn't you want to learn how to prevent it? Well, this week we continue our new cancer screening series with a look at the #1 form of cancer in the United States. It's skin cancer. Dr. David Samadi is a member of our Fox News Medical Aid team, the vice chair of the urology department at Mount Sinai. And doctor, we say screening, but in a way you're your own screener. Why at this time of year when it's cold should we be worrying about skin cancer?
You know, a lot of times you worry about skin cancer when it's summertime, but you will be exposed to the sun even during the winter time. So it's actually very important for people to pay attention to this. Now, the numbers are unbelievable. Over 1 million people in this country are being diagnosed with skin cancer every year. Some statistics mention that if you live up to 65, almost half of the population will have skin cancer once in their lifetime. So
how many types are there?
Well, there are 3 types, and I'm glad you brought it up. Basal cell carcinoma and squamous cell carcinoma, and then you have melanoma. So basal cell carcinoma is usually round, it's symmetrical. You can see the lesion here. It's fleshy, it's scaly looking type. These are curable type of skin cancers, and when it's caught early on, the cure rate is extremely high. The ones that we are really worried about are the melanomas, and you can see the picture of them, and there's a very good mnemonic for this. Now, the incidence of melanoma in this country has been going up in the last 5 years. A, B, C, and D. A is for asymmetric. You can see that if you cross a line between the lesion, the right side and the left side are asymmetrical. Borders are irregular. Color, you can see this is a flag sign. There are multiple colors in this lesion. And finally, the diameter has to be over 6 millimeters. If you see this lesion and you see this mnemonic, see your doctor immediately. This is definitely a sign of melanoma, which is very aggressive.
Who's at risk? Only fair skin, fair haired, or everybody?
Okay, so there are some individual risk factors. Age, over the age of 50 is obviously a risk for this. Fair skin, blonde hair, red hair, green eye, blue eyes, and also white male are obviously at risk. Now, if you have family history of melanoma, if you have had any kind of the moles that is not healing, those are at high risk. But there are also, Jamie, some individual behaviors, behavioral patterns. Going to the tanning salons, being exposed to CAT scans and X-rays, too much of it can cause skin cancer. And finally, environmental. Exposure to UVA and UVB, and of course the sunlight is a major risk factor for this. Prevention
is big. I wear sunscreen all year long. Do you recommend that?
I knew you were going to ask that. So you want to make sure that you protect yourself. Staying away from UVA and UVB is the best one. Protective clothing. Make sure you use sunscreen, but the sunscreen has to be broad base, has to cover UVA and UVB, SPF over 30, and absolutely waterproof, and you need to reapply if it's necessary. Simple measures to really protect yourself from this deadly disease that's simple and is curative when it's caught early on.
Early on, that's so key. I'm glad you're telling people maybe they should go get checked this week.
Absolutely.
Why not? And sunscreen expires after a year, I heard. Is that true?
Well, you need to make sure you look at the time and make sure that you use it when it's not expired.
Dr. Samadi, this is great, and we have another installment next week.
Thank you so much.
Nice to see you. Thank you very much. Kelly?